Hi, I'm Michael Nyenhuis, President and CEO of UNICEF USA. I am delighted to be joined by Dr. Vivek Murthy, the Surgeon General of the United States. Such an honor, Dr. Murthy. Thank you for joining me in this important conversation.
Well, I'm so glad that we're here to talk about a subject I know we care so much about, and that's mental health. So appreciate you doing this.
Yeah. We want to shine some light on the critical issue of mental health among children and youth. Here at UNICEF, we've recognized this as a growing priority and really too often an unmet need. It's become a key program strategy for us. For instance, in our response to the war in Ukraine, along with organizing mobile medical teams to provide basic care for physical health, we mobilized mobile mental health and psychosocial teams to provide care and support for children displaced by the war. But this growing mental health crisis is not just in war-torn places, is it? This is an issue in our own country and in our own neighborhoods. I know, Dr. Murthy, from your perspective, this is a really important challenge. Why so? And why do you think this has become such a focus of public conversation recently?
Well, I do think, Michael, that mental health is a domestic challenge here in the United States, but it is a global challenge, really. And particularly when it comes to young people, we are seeing really extraordinarily high rates of anxiety, depression, and suicide among young people here in the United States. It's one of the reasons why in December 2021, I issued a Surgeon General's advisory on the topic of youth mental health, because this genuinely is a public health crisis, and I wanted us to call the nation to attention and action to address it. I think there are a number of reasons why this is happening, particularly to youth. I think if you look at how young people are growing up today, they're just a unique set of factors that are really unusual and different, really, from what prior generations have had to deal with. Take, for example, technology. Technology has made information and news ubiquitous. And when I was growing up, if I wanted to turn off the news, I turned off the television, and then there was no more information coming at me. But that's not the case for young people today, and especially when you have media information that's flowing, that's predominantly focused on all that is wrong with the world, that creates, I think, a heaviness and I think a burden and a sense of stress, really, for young people that is different from what we had before. But the other part of technology is around social media platforms. Social media has helped some young people to connect and to find community, and that can be incredibly valuable. But I worry that for too many young people, it has actually been detrimental to their mental health and well-being, increasing, for example, their likelihood of comparing themselves to others, because that's what happens in an accelerated way on social media platforms. But it also has led them to often feel worse about their friendships with other people. And this is actually what young people tell me all around the country when I travel and talk to them about it. So I think those are two really powerful and important things to recognize about technology. But also, young people are struggling with cyberbullying, which is, again, not something that prior generations had to deal with. And we know that bullying leads to trauma, which impacts negatively their mental health and well-being. We know that loneliness has become a profound challenge for young people, and that is associated with an increase in anxiety and depression. And finally, just consider this. We've always hoped that young people growing up would be able to look at the future and feel optimistic and hopeful that the future was brighter than the past, that the opportunities that they had available would be greater than what their parents had. Yet this generation of young people growing up looks at violence in their communities, looks at the threat and scourge of racism, looks at climate change and the threat it poses to their well-being and way of life, and generally asks the question, is the future really brighter than the past? So you put all of these factors together and you have a recipe for the mental health crisis that we have today. The good news is we can do something about it, and we in fact know what to do, but mobilizing our collective will, our resources, and our attention to focus on putting in place the prevention and treatment strategies needed to address this crisis is what we're called to do right now.
Yeah, I've been involved in the public health community for a long time, and it's really great to see actually that mental health is becoming an important part of the landscape related to youth well-being. And I think my example from Ukraine is a good one, because we see mental health equal importance to physical health. Mm-hmm. In the nutrition space, we talk about stunting as a real consequence of malnourishment, but untreated mental health can have a similar effect, setting children and youth behind in their development socially, academically, and in other ways as well. I think on the one hand, we're heartened by the fact that discussions about mental health is really now coming into the mainstream. People are willing to talk about it more, I think, than they have been. This doesn't mean there isn't still stigma. There certainly is. And in certain communities, that means very strong. but increasingly people are willing to talk about it, which is great. And we know that the youth are. We do a lot of surveys of young people around the globe, and they consistently rank addressing the mental health crisis one of their very top priorities, along with climate change. You mentioned your advisory on youth mental health last year. Certainly that condition exacerbated by COVID-19. And I'm wondering, from your perspective, how far has the U.S. come in implementing some of the recommendations you put forward, and what investments do we still need to make?
Well, I appreciate that question. And thank you also for sharing your experience. Michael, I know that you've been in global health for a long time, and just seeing the evolution and how we've been talking about and thinking about mental health. So hearing your perspective on what young people are asking for globally, that they are recognizing this more and more as an issue that needs to be a priority, that's incredibly helpful to hear.
Yeah.
I do think that there are reasons to be hopeful based on the progress we are making. When I look at this particular moment in time, I see unprecedented investments that we've made just in the last couple of years here in the United States in expanding access to care. President Biden, when he came in, made mental health a priority. And as a result, through the American Rescue Plan, the ARP, we've been investing money in getting counselors into schools and expanding access to treatment. We've also since then put money into expanding certified community behavioral health centers, which are incredibly valuable and important for providing round-the-clock care, especially in some of the hardest hit areas in the country. And we're also investing in training the workforce, making sure that we have more mental health providers, because right now the demand is certainly greater than the supply. And finally, the big push that we're making right now is also around prevention, making sure that we can invest in those community and school-based prevention programs, which have been shown to work in reducing the likelihood kids will struggle with mental health concerns, but which just haven't been invested in historically. And the Safer Communities Act, which was just passed a few months ago, is actually providing now funds that we can invest in school-based mental health programs, which is a big win. So the bottom line is that there is more progress that I've seen in the last couple of years than perhaps in many of the years preceding that. That's what we need, because again, the youth are telling us, young people are telling us that mental health is a crisis, and we've got to respond accordingly with the appropriate urgency. So I'm encouraged by what's happened, but I'm also cognizant of the fact that we've got to keep going. We've got to make sure that we use technology to expand access to care for people in rural areas and people who aren't able to drive 20, 30 miles to see a mental health provider. If we can use technology to bring mental health care into schools, into workplaces, into people's homes, that's the way we're going to dramatically improve access to care. And finally, I'm just encouraged by how we're starting to talk differently about mental health care. Even though young people today are much more open about talking about mental health than prior generations were, and I think that is incredibly positive, many young people also say that there's still shame and stigma associated with talking about mental health, admitting that you're struggling, with admitting that you were bullied, for example. And they sometimes hesitate to do that. So I think this is a moment where all of us, regardless of what our background is or medical training or what have you, all of us can encourage other people to ask for help if they're struggling. All of us can check in on people in our lives and make sure they're doing okay, recognizing that you can't always tell from the outside if somebody's doing okay, because we're all experts, if you will, sometimes at concealing how we're doing and not letting the world know that we're struggling. So I'm encouraged by where we've been in the last couple of years in particular, but also cognizant about the fact that we have a lot more ground to cover to help all the young people out there who in fact need help.
I want to just ask about schools for a minute. This is a really important place, obviously, for young people in their lives, and certainly the COVID pandemic and students being out of school is one of the things that sort of ramped up this mental health challenge as we see it coming here. But now, we as well supported the legislation that pushed for more funding for school-based mental health. Can you just talk about the importance of school as a both a place where mental health services can be provided, but also critical to just the mental health of young people?
Well, schools have such a vital role to play in the lives of young people, and that's something we all know, but in particular in the mental health of young people, and that's for a few different reasons. Keep in mind, kids are spending a large chunk of their waking hours in school. And that means that the interactions they have in school with teachers and other students has an impact on how they feel. It also means that the environment in schools and what they learn about mental health in schools also can have a profound impact on their overall well-being. So I think this is an opportunity for us to think about how schools can become engines for mental health and well-being. And if we do that, not only will we help children in terms of their mental health, but we'll actually help them do better in school as well. We'll help teachers and school administrators who are struggling with much of the aftermath of unrecognized and untreated mental health concerns among children, which often manifest in their behavior or in poor school performance. So this is really a win-win for students and for teachers and schools for us to make that investment in mental health. And what it looks like, I think is important to describe, because getting more counselors into school is one part of that, right? And that's where we've, again, put billions of dollars into schools, at the beginning of 2021 through the American Rescue Plan, and asked schools to use a lot of that money to support mental health, particularly counselors. But the other thing that schools can do is to provide guidance and instruction for young people around mental health itself. What is mental health? How do we recognize if we're struggling? How do we talk about it? What are the words to use to describe actually how we're doing? The third thing schools can do is to invest in social emotional learning. Social emotional learning fundamentally, in my mind, is about helping people understand emotions and manage those emotions in themselves and in other people. And a lot of young people may not get that at home or in their community, but getting it in schools can be profoundly beneficial to their mental health, and again, spills over into other aspects of their life. And finally, I do think it's critical that we support teachers when it comes to this work around mental health and well-being. Teachers are chronically asked to do far more than they're resourced to do. They're the people that we just keep adding to-dos on, to their list, and just expect that it'll happen. But what we really need to do now is invest in the mental health and well-being of teachers too, recognizing that the mental health of teachers impacts the mental health of students. When our teachers are cared for, supported for, when they're given the tools to do their jobs and do that job well, whether it's talking about and teaching about mental health or other subjects, then kids ultimately benefit. So the bottom line is schools are a powerful force. They're a force we've got to harness in this effort to support mental health and well-being. We know how to do a lot of this. This is about now focusing our intention, our time, and our resources on making that a reality.
Yeah, and certainly, students and their peers talking with one another is a critical part of this as well. We sponsor UNICEF clubs at hundreds of colleges and high schools around the country, and have really been working with that population to create space for them to talk about mental health together, and then to carry that into their campuses and into their friend networks there. Obviously, that's a really critical role to play for young people who are courageous enough to talk about this. I know that you've been open about mental health issues, yourself, and willing to talk about it openly. How important is it for adults to talk about it, and maybe specifically parents as well?
I think it's vital for parents to talk about it. It's really critical for all of us to speak more about our experiences with mental health. Because when we talk about our own personal experiences, we are telling other people it's okay to talk about their own experiences. We're also telling them that they're not alone if they struggle. And those are two very important messages for young people in particular to receive. Look, parents have a vital role to play here. They're sharing their own experiences can be helpful. Simply starting a conversation with your child can be immensely helpful to let them know that these issues are okay to talk about, but also that if they are struggling, that you are somebody that they can come to. And so even if your child doesn't say anything in that first conversation, even if you don't feel like you know everything in terms of all the solutions to the mental health crisis, that's okay. Simply opening the door to that conversation, sharing your own experiences with your child, listening, and asking them how they're doing with their mental health, that can make a huge difference in your child's life. And finally, Michael, just a word about what you just mentioned about the UNICEF clubs as well. You're touching on something I think is absolutely vital, which is the power of peers to help peers, students to help other students. Young people are one of the most powerful resources in each other's lives. When they reach out and support one another, it makes such a difference in the lives of other children. Because, look, as human beings, we all have three critical needs, regardless of what culture or background we come from. We all want to be seen and understood for who we are. We all want to know that we matter, and we all want to be loved. And when you reach out to somebody to check in on them, when you listen after you ask them how they're doing, and and genuinely want to hear what the answer is. When you show up for them during those moments of need, you are telling them that you see them, that you understand them, that they matter, and that they're loved. And again, you don't need a medical degree to be able to do that. So one of the things that has encouraged me the most as I've traveled around the country and visited young people and talked about mental health is just to see how many young people are stepping up to help one another. In programs like the Beyond Differences program, which is now spread to schools around the country, young people are identifying folks who are struggling with loneliness and isolation in school, and they're gently, kindly, and with humility bringing them in and helping them feel part of a community. Programs like the Becoming a Man program, which began in Chicago, are these powerful programs where in small groups, young people can provide peer support to one another and have an extraordinary impact on everything from how they do in school to whether or not they run into trouble with law enforcement on the outside. So there is a tremendous amount of good that can come from peer support. And it underscores just the need that all of us have for community and social connection. And I know we live in a time when, sometimes the dominant culture around us in the modern world tells us that strength is about being independent, not needing anyone else, not being dependent on anyone, and not showing anyone your emotions. The problem is that that's not how we have evolved over thousands of years. We've evolved to be social creatures, to help one another, to trust one another, to be interdependent. And it turns out when we do that, we go far, greater distances than how we would go if we were just alone. And so this is our opportunity, this youth mental health crisis, not only to get more treatment programs in place and invest in prevention, but to come back to our roots and to recognize that we are all better off when we care for each other, when we look out for one another. And there's nothing wrong with needing each other. That's just a manifestation of who we are. And it's certainly the best way to go far and to be more than we can be on our own.
Yeah. At UNICEF, we are big believers in listening to youth and making sure they have a seat at the table. And this is one of those cases, too, where I think they have a lot to teach us here. I come from a generation where we didn't really speak about mental health issues when I was growing up, and maybe we're not as open to speak about it today. And I think there are times where youth are maybe more open to speak about it. And as much as there's a role for teachers and parents to work with youth and give them space for this, I think maybe we ought to sit down and sort of listen to them as well, because they have a lot to teach us about what they're seeing and feeling, and to help break down the stigmas maybe that we're still carrying.
I couldn't agree more. And that's one of the things that gives me hope is when I talk to young people around the country, I find they have a remarkable amount of insight into what's going on, what's driving, in fact, the way they feel about their mental health, and their peers do as well. So I couldn't agree more that they should be at the table helping not only inform how we think about youth mental health as a country and as a planet, but also helping shape the solutions and help execute those solutions, because they are certainly a key part of the solution.
Well, we certainly appreciate how you have put this on the agenda, put it on the radar, continue to talk about it. We certainly will continue to do the same thing here at UNICEF. And I think, between your work, our work here at UNICEF, all of our partners working together, we can really move the needle on this and make sure that is mainstreamed as a critical part of health more broadly for the community. So thank you for that. And any last words from you about how we move this forward?
Well, I so appreciate this conversation and all the incredible work that you and UNICEF USA is doing to address youth mental health. I'll lastly just say that, I know there are a lot of crises that we read about in the papers these days. The word crisis itself feels like it's overused. And that can feel very heavy, when we consider all that's going on in the world. But I do want to say that I know for all of us, whether we're parents or whether we have children that we care about in our lives, that we can all agree that we want the world to be better for our kids. We want them to look at the future with a sense of optimism. We want them to feel good about themselves, to feel confident in who they are, and to know that their worth is not dependent on how famous they are or how wealthy they become or how powerful they are, but that their worth is something intrinsic. It's based on their willingness and ability to be kind, to be generous, to give and receive love. That's the world that I want for my kids. That's the world I think many of us want for our children. And we have the power to shape that world right now through the choices that we make about how we show up in the world, about how we treat other people, about how we serve as a role model for our children in that regard, about how we reach out to people who may be different from us and seek to learn and understand from them instead of judging them. we also have the power to use our voice to speak up for those who can't speak up for themselves and to advocate for policies that lift all of us up. These are all ways that we can contribute to creating a world that's grounded in those fundamental values of kindness, generosity, and love. And if we do that, I think we will do so much to support our children, to serve as a role model for them, but also to bring in, I think, the positive forces that we need to support our mental health and well-being, to counter, if you will, so much of the stress and despondency and despair that people feel when they look at the world right now and wonder, do other people care about me? Do they care about each other? Well, we can answer that question definitively with a yes, through our words and through our actions. So I'm hopeful that we can build this world together. I'm confident that we can. And I feel a sense of urgency around it because, you know, our kids are depending on us, and they need us to step up and do everything we can to shape a world that's truly worthy of them and the rest of their generation.
Well, you certainly are describing the world I want to live in. So thank you for being a champion for it. And thanks for your time today.
Of course. Thanks so much.
All
Appreciate
right.
it.
Bye-bye.
Bye.